Welcome to Therapy Thursdays here in Louisiana Living. I'm Dr. Jerry Yarborough with Physical Therapy and Balance Centers. And today we have a guest speaker with us, one of our staff therapists, Dr. Rachel Adkins, and she's going to teach you about swelling and how to manage it.
Yes, like you said, we're talking about swelling today. Now, you might have swelling due to different reasons. You could have had a recent surgery, you might have had an injury, you might have some cardiac problems, or you might have weakness in an area of your body, and thus swelling can typically follow weakness. Now, why does it matter if we have swelling? Well, one, it's typically painful. When you have that fluid buildup, it increases pressure in the area, and pressure on nerves, bones, soft tissue is usually painful. And also over time, chronic swelling, because of that increased pressure, can break down the tissues and lead to things like arthritis. So we want to make sure that we are managing any swelling that is present. Now, as we talk about how to manage the swelling, I want you to imagine your circulatory system like an interstate, with your heart as the hub of the interstate. All of the fluid needs to go through the heart to be reoxygenated and then return to the heart and go to the tissues. So we're trying to get swelling back to the heart. Now, let's, for example, talk about swelling in the hand. If my hand or forearm are swollen, I'm going to try to get the fluid back to the heart, the central location. But if this whole area is swollen, I'm not going to start at this end here and push onto the area that's already swollen. If you can imagine it like that interstate, like the swelling is a traffic jam, and you've got this whole line of cars trying to get back to the heart. I'm going to start where the accident is, so to speak, and clear up the accident, then the other cars can come through. Or clear up the swelling closest to the heart, and then work your way farther from the heart. So that's our first technique to manage swelling, and it's called retrograde massage. So again, using the hand and forearm example, you're going to start at the area of swelling that's closest to your heart. So I'm going to start at the top of my forearm if my forearm and hand are swollen, and I'm going to use sweeping motions of pressure going toward my heart. So I'm never pushing away, always pulling toward the heart. And I'm going to do several sweeping motions in this section, and then I'm going to work my way farther away. Okay, so again, several sweeping motions with deep pressure, and I'm going to work my way all the way to the end of the limb. And that's retrograde massage. And you can do that on any body part. Let's say your foot is swollen. You can start at the upper part of the lower leg and work your way down to the foot. The second thing that's important for managing swelling is to elevate the limb. So maybe you didn't have an injury, maybe you sit all day long for your job, or you are in a wheelchair. Whenever our limbs are down or dependent, and we don't move as much, maybe we're sedentary because of our lifestyle choice or our jobs, then we're gonna have to manage that swelling through trying to elevate the limbs as well. And you can actually combine that with the retrograde massage. Anytime you elevate, it's ideal to try to get the limb above the heart, but you don't have to. So I would prop my hand on probably a pillow as I do that massage. Or if you are in a wheelchair or working at a desk, you can try to prop your feet on a stool throughout the day, and that little bit of elevation really helps get the fluid back to the heart.
Yeah.
Okay, the last thing for managing swelling is to use your muscles as a pump to bring the fluid back to the heart. When blood pumps away from our bodies away from the heart through the arteries, there's a high pressure system that pushes it. But when it comes back, it's coming through the veins, which have much less pressure. And so the veins need our help by moving our muscles. The veins run through the muscles, and the muscles need to squeeze or contract in order to push the blood back up. So let's go to the hand example. If I've got swelling in the hand, I'm gonna elevate it, I'm gonna do the retrograde massage, and then I'm going to move it. So I'm gonna pump the hand, and that's gonna contract the muscles, and they're gonna squeeze the blood back to the heart. And I'm gonna flex and extend the wrist, and I'm gonna make strong fists. And again, with the foot. Swelling in the foot, we're gonna flex the toes and extend the toes, and we're gonna pump the ankle back and forth and squeeze that blood back up to the heart. So those are my tips today for you to manage swelling, and I hope you find those helpful.
Thank you so much. That was some great information, and I loved your examples. That makes total sense.
Awesome.
If you're in a traffic jam, you're not going to push the car at the end.
Right.
So that's great. Thank you so much, Dr. Rachel. And thank you guys for joining us today. Remember to try these things at home to help you manage your swelling. And if you need further assistance, we have 6 locations in the area. Just give us a call. Thank you, and we'll see you next week.